All right, let's jump into a deep dive today into the world of gastroenterology. We're going to crack open some really fascinating case studies. And luckily, I'm joined by an expert to help us sort of decipher all the clues and understand what makes these cases so intriguing. And, think of this as a medical detective show, but for your gut.
Yeah, I'm really excited to dive in. One of the most compelling things about these cases is that they really highlight how important it is to look at the whole picture. When it comes to diagnosing GI issues, it's about connecting all the dots, understanding the patient's history, their lifestyle, their social context.
Okay, so let's jump right in. Case number one, 16.1, the pizza puzzle. Okay, imagine this. You get called to a scene, middle-aged woman, clearly in a lot of pain, and what's she surrounded by? Empty pizza boxes. And she's complaining of really intense upper epigastric pain. She says it's the worst she's ever experienced. So what's going through your mind right now?
Well, the first thing that jumps out at me is the sudden onset and the severity of the pain, particularly in the right upper quadrant. That's a big red flag right there.
And then you learn she has a history of GERD, duodenal ulcers, and a medicine cabinet full of medications like Anacol HC, Rolaids Refluxamine, famotidine, metoclopramide, Gaviscon. It seems like she's been battling some GI issues for a while.
Yeah, absolutely. And that past history is such a crucial piece of information. And in the exam, we find that she's guarding her abdomen. And there's that increased pain in that same right upper quadrant when you palpate the area.
Okay, so we've got intense pain, a history of GI problems, tenderness in the right upper quadrant. Could this be just a really bad case of heartburn, or are we thinking something else?
Well, while heartburn is a possibility, the location and severity of the pain combined with her history makes me lean towards something a bit more serious. Cholecystitis or inflammation of the gallbladder is pretty high on my list of possibilities.
Interesting. Now those pizza boxes are looking a lot more relevant.
Right, exactly. A fatty meal, like, you might get with multiple pizzas, can actually trigger a gallbladder attack. So the pizza isn't just a random detail. It could be a key piece of the puzzle here.
Wow, so seemingly insignificant details can actually be pretty important clues. All right, are you ready to tackle the next case?
Absolutely, bring it on.
All right, case number 2, 16.2, the peanut butter problem. So we have a teenage boy complaining of abdominal pain and vomiting after lunch, but he mentions that he's had similar discomfort before. What's different about this case compared to our pizza-loving lady?
Well, in this case, the onset of pain is gradual, not sudden. So that's an immediate differentiator. It kind of shifts our thinking a little bit.
And get this, his lunch was a peanut butter and jelly sandwich. Do you think that's a clue, or are we reading too much into it?
Well, you never know with GI cases. Even the most seemingly innocent foods can sometimes cause problems, especially if there's a sensitivity or intolerance there. So we always want to consider the patient's dietary history.
Okay, good point. So during the exam, the doctor notes visceral tenderness, which means pain when pressing on the abdomen over the affected organ, and rebound tenderness, which means the pain increases when the pressure is released. In the right lower quadrant, what's the likely diagnosis here?
Well, based on this presentation, appendicitis is a strong contender. And you remember how the location of the pain during palpation was different in that first case? That's one way we can start to distinguish between cholecystitis and appendicitis.
So 2 cases, 2 very different presentations, but both involving pain in the abdomen. It really highlights how crucial it is to pay attention to those nuances.
Absolutely. Every detail matters.
All right, get ready for a more challenging one. Case 16.3, disturbing.
Well, the alcohol abuse history definitely stands out to me. Alcohol abuse can lead to a variety of gastrointestinal problems. And the chest pain, combined with his history and current symptoms, makes me concerned about esophageal varices.
No, you're going to have to explain that one. I'm not familiar with that condition.
Sure. Esophageal varices are essentially enlarged veins in the esophagus, similar to varicose veins you might see in the legs. But these veins are fragile and prone to bleeding, especially in someone with a history of alcohol abuse. Long-term alcohol use can damage the liver, leading to a condition called cirrhosis, which increases pressure in these veins, making them even more likely to rupture.
So we're talking about a potentially life-threatening situation here. It's amazing how something like alcohol abuse can have such a ripple effect on the body, even leading to a condition like this.
It really is a stark reminder of how interconnected our bodies are and how lifestyle choices can have far-reaching consequences.
All right, on to our final case for this part of the deep dive, case 16.4, the high-stress weekend. This one involves a businessman who's experiencing intense abdominal pain, but with the twist.
The twist being black terry stools, a classic sign of a serious gastrointestinal bleed. This is a significant finding that really changes the urgency of the situation.
And it turns out this businessman had a very eventful weekend. He was dealing with a lot of anxieties, barely slept, and had more than a few drinks to cope with the stress. It's making me wonder if his lifestyle played a role in this.
It's definitely a factor worth considering. Stress, alcohol use, lack of sleep can all wreak havoc on the digestive system. They can exacerbate existing conditions like ulcers or gastritis, and even contribute to the development of new problems.
So we're looking at a possible ulcer gastritis, or even those esophageal varices again. It seems like stress really is a silent killer in a way.
It can certainly contribute to a wide range of health issues,
Hmm.
including gastrointestinal problems. It's crucial to understand how stress impacts our bodies and to find healthy ways to manage it.
Wow, what a whirlwind of cases. We've got pizza, peanut butter alcohol, and stress all playing a part in these gastrointestinal mysteries.
It's fascinating, isn't it? It's like putting together a puzzle, considering all the pieces to get a complete picture.
Exactly. But before we try to solve the whole puzzle, I want to take a closer look at the diagnostic process itself. How do doctors narrow down the possibilities and arrive at a diagnosis?
Well, it all starts with gathering information. A thorough patient history is absolutely essential. We need to know about their symptoms, their past medical history, their medications, their lifestyle habits, even their social situation. All of these factors can provide valuable clues.
And then there's the physical exam, right? We've
Okay.
talked about palpation, but what else are doctors looking for?
Well, observation is key. We'll assess the patient's overall appearance. Are they in obvious distress? Are they pale or sweating? These can provide immediate clues about the severity of the situation. We'll also check their vital signs: heart rate, blood pressure, respiratory rate, and temperature. These can indicate how stable the patient is and whether there's an underlying infection or other systemic issues.
So it's about piecing together all these clues, like a detective, looking for patterns and consistencies, anything that might point to a diagnosis.
Exactly. And sometimes we need additional tools to help us see that bigger picture. Blood tests, imaging studies like ultrasounds or CT scans, and even endoscopies can provide more detailed information about what's going on inside the body.
Speaking of endoscopies, that reminds me of our patient with the suspected esophageal varices. That seems a pretty serious condition that might require immediate intervention.
You're right. Esophageal varices, as we discussed, are those fragile, enlarged veins in the esophagus that can rupture and bleed profusely. It's a life-threatening emergency. That often requires an endoscopy to assess the severity and potentially stop the bleeding.
And it often stems from chronic alcohol abuse, which brings us back to the idea that our lifestyle choices can have a profound impact on our health, sometimes in ways we might not even realize.
Absolutely. Our habits and behaviors play a significant role in shaping our overall well-being, and that includes our digestive health.
That's a powerful message. It seems like we're starting to see some common threads emerge from these cases: the importance of a holistic approach, the role of lifestyle factors, and the interconnectedness of our physical and mental health.
I'm glad you're picking up on the themes. They're really essential for understanding not just these specific cases, but the broader picture of gastrointestinal health.
All right, before I move on, I want to circle back to something you mentioned earlier, the social determinants of health. You alluded to this when discussing the patient found in his apartment. Can you elaborate on how social factors can impact gastrointestinal health?
Certainly. Social determinants of health encompass a wide range of factors, including socioeconomic status, access to
Mhm.
healthcare education, neighborhood environment, and even social support networks. All of these elements can influence a person's health outcomes, including their digestive health.
Can you give us some specific examples of how those social factors might play out in the context of gastrointestinal health?
Absolutely. For instance, someone living in a food desert with limited access to fresh, healthy foods may be more likely to develop nutritional deficiencies or experience digestive problems related to a poor diet.
That makes sense. If you don't have access to fresh fruits and vegetables and whole grains, it's going to be difficult to maintain a healthy gut microbiome.
Exactly. And then there's the issue of access to health care. If someone lacks health insurance or can't afford to see a doctor regularly, they might delay seeking treatment for digestive symptoms, allowing a condition to worsen over time.
So it's not just about individual choices, it's about the systems and structures that create barriers to good health.
Precisely. We need to acknowledge that not everyone has an equal opportunity to achieve good health. The playing field isn't level.
It's a complex issue, but it's one we can't ignore. So what can be done to address these social determinants of health and create a more equitable healthcare system?
Well, it requires a multi-pronged approach. We need policies that promote economic opportunity, affordable housing, quality education, and access to healthcare for all. We also need to invest in community-based programs that address the specific needs of underserved populations.
It sounds like it's going to take a collective effort from policymakers, healthcare providers, and community organizations.
Absolutely. It's a societal issue that requires a societal solution.
Well said. So we've covered a lot of ground already, from pizza-induced gallbladder attacks to the social determinants of health. And we've only just begun.
There's so much more to explore in the world of gastroenterology. We'll be delving deeper into these cases, discussing treatment options, and exploring the latest research in upcoming parts of this deep dive.
I'm already fascinated to hear more. It's amazing how much we can learn from just a few cases.
It's true. Each case is a window into the complexity of the human body and the intricate interplay of factors that influence our health.
Well, on that note, let's take a short break, and we'll be back soon with more insights and analysis.
These cases really highlight how interconnected everything is, when it comes to our health. Sometimes the most unexpected things can impact our digestive system.
Absolutely. It makes you realize just how much is going on beneath the surface, so to speak. But let's zoom back in on one particular element we've touched on a few times: stress. You mentioned how stress played a role in case 16.4, but I think it deserves a bit more attention.
Yeah, I agree. Stress is often an overlooked factor in gastrointestinal health. We tend to think of stress as a mental or emotional issue, but it has very real physical consequences, especially for our digestive system.
Can you break down that connection for us a little bit? What's actually happening in the body when we're stressed that can lead to digestive problems?
Well, imagine this. You're faced with a stressful situation. Maybe you're about to give a big presentation, or you're stuck in traffic. Your body kicks into that fight or flight mode, releasing hormones like cortisol and adrenaline. These hormones prepare your body to deal with the threat, but they also have a number of effects on your digestive system.
So it's like our body is prioritizing survival over digestion when we're under stress.
Exactly. One of the things that happens is that blood flow is diverted away from the digestive system and towards the muscles and brain. This can slow down digestion and lead to problems like indigestion, bloating, and constipation.
Makes sense.
You know,
If you're running from a tiger, you don't really need to be digesting your lunch at that moment.
right. Stress can also increase inflammation in the gut, making existing conditions like irritable bowel syndrome, IBS, or inflammatory bowel disease, IBD, even worse. And here's the really interesting part. Stress can actually alter the composition of our gut microbiome.
Wait, you're saying stress can change the bacteria that live in our gut?
That's exactly what the research is showing. The gut microbiome is this complex ecosystem of trillions of bacteria that play a crucial role in digestion, immunity, and even mental health. When we're stressed, the balance of these bacteria can be disrupted, leading to a whole host of problems.
Wow, it's incredible how much we're learning about the gut microbiome these days. It seems like it's involved in everything.
It really is a fascinating area of research, and it's changing the way we think about health and disease. The more we understand about the gut-brain connection, the more we realize how important it is to manage stress, not just for our mental well-being, but for our digestive health as well.
So what are some effective strategies for managing stress, especially when it comes to protecting our gut? I've heard things like yoga and meditation can be helpful.
Those are definitely great options. Exercise in general is fantastic for stress reduction. Even something as simple as a brisk walk can make a difference. Mindfulness practices like meditation and deep breathing can also help calm the nervous system and reduce the production of those stress hormones.
It seems like it's about finding activities that help us relax and de-stress.
Exactly. And it's important to find what works for you. Some people find solace in spending time in nature, while others might prefer listening to music or spending time with loved ones. The key is to identify activities that help you feel calm and grounded.
So it's about incorporating those stress management techniques into our daily lives, not just as a quick fix when we're feeling overwhelmed.
Precisely. It's about creating a lifestyle that supports both our mental and physical health. And remember, getting enough sleep is crucial too. When we're sleep deprived, our stress levels tend to skyrocket, which can trigger that whole cascade of negative effects on our gut.
It seems like we keep circling back to this idea of a holistic approach. Taking care of our gut isn't just about what we eat. It's about how we manage stress, how much we sleep, and even the social connections we have in our lives.
Exactly. It's about seeing the bigger picture and understanding how all these different aspects of our lives influence our overall health and well-being.
That's a powerful message. It really makes you stop and think about the choices you're making and how they might be impacting your gut health.
And that's ultimately the goal, isn't it? To empower people with knowledge so they can make informed choices that support their health.
Absolutely. Now, before we wrap up this deep dive, I want to shift gears a bit and talk about the social determinants of health. We've touched on this throughout the episode, but I think it deserves a dedicated conversation.
I agree. Social determinants of health are a crucial piece of the puzzle when it comes to understanding health inequities.
Can you remind us what exactly falls under the umbrella of social determinants of health?
Well, it's a broad term. That encompasses the conditions in which people are born, grow, live, work, and age. These conditions are shaped by the distribution of money, power, and resources at global, national, and local levels.
So we're talking about factors like income, education, housing, access to health care, and even neighborhood safety.
Exactly. These factors can have a profound impact on a person's health, including their digestive health.
Can you give us some specific examples of how social determinants of health might affect someone's risk of developing a gastrointestinal condition?
Certainly. Let's consider access to healthy food. If someone lives in a food desert, an area with limited access to affordable and nutritious food, they might be more likely to rely on processed foods, fast food, or convenience stores, which can contribute to a number of digestive problems.
That makes sense. If you don't have access to fresh fruits, vegetables, and whole grains, it's going to be difficult to maintain a healthy gut microbiome.
Exactly. And then there's the issue of access to health care. If someone lacks health insurance
Right.
or can't afford to see a doctor regularly, they might delay seeking treatment for digestive symptoms,
Yeah.
allowing a condition to worsen over time.
So it's not just about individual choices, it's about the systems and structures that create barriers to good health.
Precisely. We need to acknowledge that not everyone has an equal opportunity to achieve good health. The playing field isn't level.
It's a complex issue, but it's one we can't ignore. So what can be done to address these social determinants of health and create a more equitable healthcare system?
Well, it requires a multi-pronged approach. We need policies that promote economic opportunity, affordable housing, quality education, and access to health care for all. We also need to invest in community-based programs that address the specific needs of underserved populations.
It sounds like it's going to take a collective effort from policymakers, healthcare providers, and community organizations.
Absolutely. It's a societal issue that requires a societal solution.
Well said. So we've covered a lot of ground in this deep dive, from the intricate workings of the digestive system to the broader social factors that influence health outcomes. What's the one key takeaway you want our listeners to leave with?
I think the most important message is that our digestive health is intricately connected to our overall well-being. Taking care of our gut means taking care of our entire selves, mind, body, and spirit. It means making healthy lifestyle choices, managing stress effectively, and advocating for policies that promote health equity for all.
That's a powerful message. It's a reminder that health is a multifaceted and interconnected concept. It's not just about what we eat or how much we exercise. It's about the environments we live in, the resources we have access to, and the social connections we cultivate.
Exactly. It's about seeing the bigger picture and understanding that health is a collective responsibility.
Well said. I think we've given our listeners a lot to think about.
I hope so. And I hope this deep dive has sparked a curiosity about the fascinating world of gastroenterology and the importance of prioritizing gut health.
All right, we're going to take a short break, and we'll be back soon to wrap up this deep dive with some final thoughts and insights. Welcome back to our deep dive into gastroenterology. I don't know about you, but I'm feeling a lot more aware of what's going on in my gut. After all these cases and insights, it's amazing how much we take our digestive system for granted until something goes wrong.
It's true. We often only start paying attention to our gut when we're experiencing, discomfort or symptoms. But as we've seen, there's so much more to digestive health than just the absence of pain.
Exactly. It's about understanding that complex interplay of factors that contribute to a healthy gut, from the food we eat to the stress we experience to the social environment we live in.
And it's about recognizing that our digestive health is so intricately linked to our overall well-being. When our gut is healthy, we tend to feel better both physically and mentally.
Speaking of feeling better, I'm curious to hear your thoughts on treatment options for some of the conditions we've discussed. What are some of the approaches doctors take to address these gastrointestinal problems?
Well, the treatment approach really depends on the specific condition and the individual patient. For some conditions like GERD or IBS, lifestyle modifications can be very effective. Things like dietary changes, stress management techniques, and regular exercise can make a big difference.
So it's often about empowering patients to take control of their health and make sustainable changes.
Exactly. But of course, there are times when medications or even surgery are necessary. For example, in the case of esophageal varices, where there's a risk of life-threatening bleeding. Medical intervention is critical.
It's about finding the right balance between lifestyle modifications and medical interventions, tailoring the approach to the individual's needs and circumstances.
Precisely. And it's important to have open communication with your healthcare provider, discussing your symptoms, your concerns,
Uh-huh.
and your treatment preferences.
It's about being an active participant in your own healthcare journey.
Absolutely. Now, I know we've been focusing a lot on the challenges
Yeah.
and complexities of gastrointestinal health, but I also want to emphasize that there's a lot of exciting research happening in this field.
Oh, tell me more. I'm always fascinated by the latest scientific discoveries. What are some of the areas that are particularly promising right now?
Well, as we touched on earlier, the gut microbiome is a hotbed of research activity. Scientists are uncovering more and more about the role these trillions of bacteria play in our overall health. And they're developing new therapies that target the microbiome to treat a variety of conditions.
So we might be seeing a whole new wave of treatments that focus on manipulating the gut microbiome to improve digestive health and even overall well-being.
That's the hope. There are also promising advances in areas like personalized medicine, where treatments are tailored to an individual's genetic makeup and specific needs. And there's a growing understanding of the gut-brain connection, leading to new approaches for addressing the link between digestive health and mental health.
It sounds like there's a lot to be optimistic about when it comes to the future of gastroenterology.
There certainly is. We're making significant strides in our understanding of the digestive system and how to keep it healthy.
Well, I don't know about you, but I'm feeling a lot more knowledgeable about my gut after this deep dive. I've learned so much about the different conditions, the diagnostic process, the treatment options, and even the exciting research that's on the horizon.
I'm glad to hear that. Knowledge is power, especially when it comes to our health.
And hopefully this knowledge will empower our listeners to take better care of their digestive health and advocate for a more equitable healthcare system that addresses the social determinants of health.
That's my hope as well.
Well, I think we've covered just about everything we set out to explore in this deep dive. Any final thoughts you'd like to leave our listeners with?
Just this. Listen to your gut. It's trying to tell you something. Pay attention to your body's signals. Seek help when you need it, and don't be afraid to ask questions.
Great advice.
Well,
And remember, even small changes in your diet, your stress management techniques, or lifestyle habits can make a big difference in your digestive health. All right, folks, that's a wrap on our deep dive into the fascinating world of gastroenterology. We hope you've enjoyed the journey and learned something new along the way. Until next time, stay curious, stay healthy, and keep exploring.